There will always be children who need help, children who are neglected or abused, children whose parents cannot or will not care for them, children on the verge of adulthood who desperately need help preparing for life on their own in the world. Because there are people in need, intervention services exists. Independent living services, adoption, outpatient services, juvenile justice services, foster care services, and education and training are proudly offered, all under one roof. You're about to experience the guiding hand and caring heart of intervention services. We'd like you to meet some of your neighbors, people we're very proud to consider important members of the intervention services family.
The Village is a transitional living facility for youth aging out of the foster care system. Youth that turn 18 in the foster care system have to leave on their 18th birthday. Many of those youth don't have their high school diplomas yet, do not have work readiness skills, and at the Village we help them stay in school and help them develop those skills that they need to be successful. We work on getting them jobs and preparing for the workforce, how to apply for college, and their general life skills.
For teenagers like Michelle, intervention services is there to lend a guiding hand and a caring heart.
When I was 7 years old, I lived in Puerto Rico, but we had to come to Florida because my dad was abusive. So me, my mom, and my sister came to Florida. And things got worse because she started, dating boyfriends, and one of them didn't treat her really good, started, abusing her. So she was abusing me and my sister a lot, and we got taken away. And I decided that I didn't want to go back home. So we didn't go back home, and I've gone through a lot of group homes and shelters and all this stuff.
When Michelle first got here, we didn't really get along. She didn't want to be told that you have to go to school, that you can't just do whatever you want to do, that to be successful there are still rules in life, and there are rules everywhere and you need to follow them. So Michelle was in my office often, yes, but now she's here by choice, and before she was there because she had to meet with me to discuss what was going on and to get her back on track.
I love Miss Kathy. She's like, really, at first, it was like, wow, she's actually telling me what I need, And sometimes it's hurtful, but it's like her words, they really motivated me. Like, nobody's ever told me, you need to go to school, you have to, whether it's a nice or a bad way. She told me straight out, I need a job, I need a bank account, I need to go to school in order to go to college, I need all this stuff. And I talked to her about everything.
Michelle has a really bright future. She's really buckled down. She's doing great in school now. She's going to graduate on time with her class, which is amazing considering she's been to 8 high schools. She plans on going to SCC, getting her AA degree, and then go on and getting a 4-year degree at UCF. She's a fabulous artist. She's full of life, and she's just going to make it in the world and be a productive member of society.
When bad decisions are made, a life can quickly spiral out of control. Intervention Services has the staff and the experience to turn lives around.
I first began working with Linda about 3 months ago, and she was living at the transitional living facility that she's at now for substance abuse recovery. And at that point, we did an assessment and we identified different issues that she needed to work on and where she was in her life, and we set up treatment goals, and we began our counseling services together. And her primary issues that we identified were helping for her substance abuse recovery and also for her self-esteem.
Last June, I got to the point where I was miserable. I hated myself. I hated what I was doing. I began pawning my parents' things because I had pawned all my things, and that was completely against my moral fiber. But I couldn't stop myself. I couldn't stop myself from using the drug. So I knew I either had to get help or I was just going to end my life. But I have a 2-year-old daughter, so I didn't want to miss her growing up.
Well, Linda in January had a relapse, and I think that just the way she handled the relapse really represented how great she was doing, because not only did she have a relapse, but after the relapse she actually came clean. She came and admitted that she had a relapse.
When I had my relapse in January, my biggest fear was telling my parents. Not that they would be upset, but that it would hurt them. And Sarah arranged a family counseling session so they could come to the house and she could be here and help me tell them.
And I was there to support her in telling them and gaining more support for her so that she would get back on track, and she did beautifully get back on track.
She's helping me look at, not just being on my own, but actually living my dreams. What are my dreams? What do I want to do? So hopefully teaching, maybe working on a teaching degree, in my own place with my daughter. Still involved in 12-step programs, maybe outpatient counseling, and, just living day to day.
All too often, a child's life is hard from the very beginning.
When I met Spencer, he was being put in a foster home, a medical foster home, and I became his medical nurse. And he was only 3 months old when I met him. And I was told that he wasn't going to be doing too much. He was just he had a lot of medical issues, and he was just going to be a patient that I'm going to have to do everything for, all of his care. And I just started taking care of him from then.
At Intervention Services, we find placements for children in foster care, children who have been removed from their parents or who have been removed from a previous foster home.
When I was his medical nurse, I just fell in love with him. And I always thought in my heart that I wanted to adopt him because he was such a precious little child.
Once Miss Robeck was aware that Spencer was freed for adoption, that he was adoptable, she communicated that with Spencer's case manager. And as soon as we heard that, I immediately called her, came out and met her, and I felt in my heart the love that she had for him.
He does have a lot of medical issues, so we do a lot of, going to doctor's appointments and making sure his health that's the #1 thing for me. And it's also real important to me to keep up with his therapies, like his speech therapist and his occupational and physical therapy. I love teaching him sign language that we can work together because he has deformities of his hands. So it's sign language we've learned to maneuver ourselves.
Our mission with Intervention Services and our foster children is to provide permanence for these children, safety for these children, make a permanent match for these children. In Spencer's case, I could see it, I felt it in my heart the first time I met Miss Robeck. There was a deep connection there. She has loved him for, since she started caring for him.
I just fell in love with Spencer, and it was a big decision of mine to make a change in my career and become a medical foster parent, just so I could stay at home and make a living, taking care of Spencer and other children just like him that needed a good home.
Thank you for taking the time to meet some of your Central Florida neighbors who are part of the Intervention Services family.
If it weren't for Intervention Services or the villages, I would probably be at the streets, probably be, renting a room from a friend. I wouldn't be in school. I know that for a fact, because I would have to have a job to pay my things. I really wouldn't be nowhere, and I wouldn't be going to college at all.
It's very helpful to have that one-on-one personal counseling. I really look forward to our meetings every week, and she helps me a lot with self-esteem, with journaling how I'm feeling every day so I can look back and see where I'm going, setting boundaries for myself.
I think Intervention Service is a great thing, and I would like to say thank you to them because they gave me hope. I didn't know if I could do it, And they gave me hope and they gave me guidance of what would be the next step.
Help us rebuild broken lives. Help us strengthen individuals by teaching them how to care for themselves and plan for their future. Help us help Central Florida's youth. Intervention Services, a guiding hand, a caring heart.